Scene opens with dramatic animation of an aorta against an ominous musical backdrop. Narrator voiceover. Imagine your aorta, your body's largest blood vessel, silently collapsing from within. All because of a centuries-old sexually transmitted infection. Welcome to the mysterious world of septic arthritis. Transitioned to a close-up of a gross pathology video featuring an inflamed aorta. Superimpose the title of the show on the video. Text on screen. Syphilitic Aortitis, the silent aneurysm, wrongly assumed extinct, yet it still lurks in the shadows. Join me as we peel back the layers of this rare condition and uncover its historical roots while exploring a groundbreaking case that brought this forgotten disease into the spotlight once again. Let's begin with the building blocks of knowledge. Transition to an animation showcasing the layers of the aorta with a focus on the outer layer, the adventitia. Overlay the term vasa vasorum onto the tiny blood vessels within the adventitia. Segment 1. What is syphilitic aortitis? Syphilitic aortitis refers to inflammation of the aorta specifically during the tertiary stage of syphilis. This late complication affects the vasa vasorum, the blood vessels that supply the aortic wall. Targeting these vessels can lead to weakening of the arterial wall, causing dilation or ballooning known as an aneurysm. Understanding where this inflammation occurs is key. The aorta, your body's main artery, carries oxygen-rich blood away from the heart. Structurally, it's made up of 3 layers. The innermost layer, the intima, is in direct contact with the blood. Middle layer, the media, is crucial for regulating blood pressure and diameter. And the outermost layer, the adventitia, holds the key to today's mystery. Within the adventitia lies the vasa vasorum, a network of small blood vessels responsible for nourishing the aortic wall itself. When syphilis, a bacterial infection caused by Treponema pallidum, reaches the vasa vasorum, it triggers a specific type of inflammation known as vasculitis. But why does this happen and how does it relate to the development of aneurysms? You might think of aneurysms as bulges in a weakened artery wall. However, syphilitic aortitis offers a unique perspective on aneurysm formation, highlighting the critical role of the vasa vasorum in maintaining the structural integrity of the aorta. The pathogenesis of syphilitic aortitis involves a complex interplay of immune responses and tissue damage. As syphilis progresses to its tertiary stage, it can spread to various parts of the body, including the vascular system. The bacteria then invade the blood vessels, leading to inflammation and weakening of the arterial walls. Over time, this weakens the aorta, leading to dilation and increasing the risk of aneurysm formation. Transition to an animation that depicts the inflammation of the vasa vasorum caused by syphilis. Show the subsequent reduction in blood flow to the outer part of the aortic wall. Segment 2. The pathogenesis. How it develops. The pathogenesis of syphilitic aortitis involves several key steps that ultimately lead to the formation of aneurysms. The thickening of the vasa vasorum walls reduces blood flow to the outer 2/3 of the aortic wall. Without adequate blood supply, the aortic wall, particularly the media and adventitia, starts to become starved of oxygen and nutrients. This ischemia triggers the breakdown of elastic fibers and the death of muscle cells. The combination of reduced elasticity and increased weakness makes the aorta more susceptible to dilation, eventually forming an aneurysm. The process of aneurysm formation is slow and can occur over several decades. During this time, the infected individual may not experience any symptoms, making regular checkups crucial for early detection. Transition to a mood board featuring staged syphilis lesions, heart scans showing an aneurysm, and an illustration of a diastolic murmur. Also include a photograph of a water hammer pulse. Segment 3. Clinical clues and rarity. Syphilitic aortitis often remains silent until an aneurysm develops, making routine checkups essential. During physical examination, doctors might pick up on other tertiary signs like gummas, which are soft, rubbery skin lesions. Neurological symptoms may also be present, pointing towards neurosyphilis. Additionally, some patients might experience rare chest pain or breathlessness. In developed countries, Thanks to the widespread use of penicillin, syphilitic aortitis is now rare. However, its potential for severe complications highlights the importance of early recognition and treatment. Transition to a split screen showing animations of syphilis testing and injection of penicillin. Segment 4, Real-World Case Study, Cardiogenic Shock from Syphilitic Aortitis. To further understand the impact of syphilitic aortitis, let's examine a real-world case that brought this rare condition into the spotlight. A 57-year-old man presented to the emergency room in cardiogenic shock. His health had been deteriorating over the past few months with progressive dyspnea and lower extremity edema. On examination, he was found to have a wide pulse pressure, a diastolic murmur, and a water hammer pulse. These findings suggested aortic regurgitation, a condition where the aortic valve doesn't close properly, allowing blood to flow back into the left ventricle. An echocardiogram revealed severe aortic regurgitation, along with hollow diastolic flow reversal, a hallmark of pneumonia aortitis. Further testing showed that he had a positive rapid plasma regain test, or RPR, at a high titer, indicating a strong likelihood of syphilis infection. Ultimately, the patient was diagnosed with syphilitic aortitis complicated by aortic regurgitation. This case is significant not only because of its rarity, but also because it showcases the potentially life-threatening complications of untreated syphilis. Treatment included intravenous penicillin and mechanical circulatory support. Additionally, the patient underwent surgery with aortic root resection and valve replacement. Fortunately, he recovered well from the surgery, highlighting the life-saving potential of early diagnosis and treatment. This case serves as a reminder of the importance of considering syphilis in the differential diagnosis, especially in individuals who might have been exposed. Transition to a split screen. On one side, show a simplified reenactment animation of the patient's condition. Segment 5, Diagnosis and Treatment. The diagnosis of syphilitic aortitis is primarily based on clinical suspicion supported by imaging studies such as CT scans or echocardiograms. The presence of an aortic aneurysm or aortic regurgitation strongly suggests the condition. Serological tests like the RPR and VDRL, which detect antibodies against T. pallidum, are also crucial in confirming the diagnosis. A final diagnosis can be established through a biopsy of the aorta during surgery or post-mortem, identifying the characteristic inflammation and bacteria. Treatment of septic arthritis is straightforward but life-saving. Due to the unique characteristics of Treponema pallidum, the bacteria remains sensitive to penicillin, making it the drug of choice for treatment. Intravenous administration of penicillin G is recommended for optimal results. In addition to antibiotics, surgical intervention may be necessary in cases involving aneurysm or aortic regurgitation. Repairing or replacing the affected sections of the aorta can restore proper blood flow and reduce the risk of further complications. Overall, early diagnosis and prompt treatment are vital to prevent the progression of syphilitic aortitis and its potential life-threatening consequences. Transition to a split screen. On one side, show animations illustrating the process of diagnosing syphilitic aortitis through various methods. On the other side, show animations illustrating the surgical repair of an aneurysm and valve replacement. Segment 6, Historical and Anatomical Insights. Syphilis has a long and sinister history dating back centuries. Throughout time, it has been known by different names reflecting its evolving understanding and impact on human health. In the early 20th century, syphilitic aortitis was commonly referred to as Dohle-Heller aortitis, named after the German pathologist Karl Dohle. His meticulous anatomical descriptions of the disease in 1916 provided valuable insights into its nature and progression. Despite its historical significance, the condition fell out of the spotlight, mistakenly believed to be eradicated. However, the emergence of new cases has brought it back into focus. Even in 1916, studies highlighted the challenges in diagnosing syphilitic aortitis. The condition often went unrecognized or was masked by coexisting atherosclerosis, which added to its complexity and hindered early intervention. The mortality rate associated with this form of syphilis was substantial, with some reports indicating a 60% death rate, underlining the severity of the condition. Show an overlay image of vintage medical book illustrations depicting aortic lesions caused by syphilis. Fade this layer with an image of Karl Dahl himself. Segment 7. Why it still matters today. In today's world, it's easy to assume that diseases of the past remain confined to history books. However, the story of Syphilitic Aortitis serves as a stark reminder that old foes can resurface in new and unexpected ways. Thanks to advances in medicine, the threat posed by syphilis has been significantly reduced. Yet its presence continues to linger, particularly in areas affected by HIV. Syphilis has shown a remarkable ability to adapt and survive despite our best efforts to contain it. This resurgence underscores the need for continued vigilance. Moreover, antibiotic resistance, a growing concern worldwide, adds another layer of complexity to the treatment of syphilis. As we face this evolving challenge, it's crucial to remember the lessons of the past. Understanding the historical context of systolic aortitis and the emergence of syphilis allows us to better address the issue today. Global disparities in access to healthcare and education also play a significant role. Lack of awareness and limited access to testing and treatment contribute to the persistence of this disease. Educating individuals about sexual health, promoting safe practices, and ensuring equitable access to healthcare services are vital in curbing its spread. Syphilis may be a disease rooted in history, but its consequences are monumentally modern. By learning from the past and embracing preventive measures, we can navigate the challenges of today and build a healthier future. Scene fades with a close-up shot of an inflamed aorta superimposed with the heartbeat animation. The music softens to a dramatic finish. Narrator, the scar across your heartbeat, syphilitic aortitis, may be rare, but its consequences are monumental. Speak up, get tested, and protect your heart from history's oldest assassin. End screen displays the call to action. Like, subscribe, and ring the bell to explore more hidden medical mysteries. This encourages audience participation and helps promote the show. Thank you for tuning in. Stay curious and keep asking questions. Your engagement fuels our passion for uncovering more hidden medical marvels. Until next time, stay healthy and keep exploring the fascinating world of medicine.